Welcome back, guys. We have a fantastic episode for you today. I'm really excited for you to listen to it and to meet my guest, Dr. Thomas Levy. I've been running into him at conferences for a couple of years now. The man is a legend, and you will find out why when you listen to the episode. But before we jump in, I, of course, want to thank you for being here and thank you for all the comments and questions and all the amazing things that I get from you guys. And I would like to invite you to follow me on Instagram at Natalie Nidham, because that way we can keep in touch. I post lots of other content there as well as podcast stuff. Plus, if you want to kind of keep in touch a little bit more than that, you can head over to natnidham.com and sign up for my newsletter. And if you want to get up close and personal, you want to hang out with me in live online Q&As and also meet some of my podcast guests and get to ask them questions directly, then you might want to join the membership community. And that membership community you can find out about on my website, natnidham.com. It's the place where you go, natnidham.com, sign up for the newsletter. You get an 8-part series on all the lifestyle ways to prepare the terrain to do more advanced health and longevity strategies. And you get to find out also about the community there as well. So we're going to thank a couple of sponsors, and then we're going to jump into the episode. And one last thing, if you're feeling inspired about this episode or any other episode, make sure to share it with your friends and family and network or anyone else you think would get value from it. And also, if you're feeling extra generous today, just leave us a review on whatever platform you're listening to the podcast on. What if I told you that one of the biggest secrets to staying young, fighting disease, and even keeping your heart and arteries in top shape is not just about hitting the gym or eating clean? I mean, look, those are big deal, but there's obviously more to it than that. Dr. Thomas Levy is here today to explain why oxidative stress is public enemy number one, and how vitamin C, not the fanciest molecule on the planet, yeah, that same one in your morning OJ, if you're even still drinking OJ, is actually one of the most powerful tools for staying healthy. But before we get into all that, let me introduce you to Dr. Levy. Not only is he a board-certified cardiologist, he's also a bar-certified attorney, because apparently one career just wasn't enough. Talk about an overachiever. After 15 years in cardiology, he uncovered the shocking connection between dental toxicity and chronic disease, sending him down a research path that changed everything. Now, with 13 books under his belt and a spot in the Orthomolecular Medicine Hall of Fame, he's on a mission to show you how vitamin C and antioxidants can help prevent and even reverse disease. Trust me, you do not want to miss this one. Hey folks, just a quick reminder that all of the information presented in this podcast is for information purposes only. No medical advice, no diagnosing, no treatments suggested here. Before you try anything that you hear about or learn about here, make sure that you check with your medical provider. Welcome to the show, Dr. Thomas Levy. It is an honor to have you here. Thank you so much for taking the time today.
My pleasure.
Yeah, well, I mean, I think we've probably crossed paths a couple of times at one particular conference. And I know the first time I said, oh, we really need to record a podcast. And then a year went by. And then I saw you again this year. And I'm like, all right, this year we're making it happen. And it only took us, 6 months to make it happen. So you are a busy, busy man.
There were so many things that came up, and I felt so bad every time I rescheduled. But hey, well, we got it now.
What's important is that we're here.
But actually, I have more information now than I would have had earlier. So it all works out well.
Right? There you go. People like you are constantly moving and shaking and amassing new information. So it's always good sometimes to record later. So we're going to talk about a very interesting topic today, I think. And basically we're talking about oxidative stress on the body, right? And how, the work that you've done shows that it is essentially at the root of aging, at the root of disease formation. And I know that, and premature aging, more importantly. So I would love, just to kick us off, let's just talk about oxidative stress, premature aging, and, where did you start this journey yourself even? What got you interested in this?
Oh, Dr. Hal Huggins, a biological dentist 30 years ago. And to make a long story short, it was in Colorado Springs, Colorado. We got to know each other. He said, come by my clinic, see what we're doing. I was practicing quote unquote traditional cardiology at the time.
Okay.
And in a nutshell, after a visit or two, I saw a bunch of things happen to patients, like in wheelchairs and other conditions that modern medicine told me wasn't supposed to happen. And I'm not in the habit of denying what my eyes have witnessed, etc. And in one particular case, a patient just got so much better while getting hours of debilitating dental work. And I realized it was because she had an intravenous IV vitamin C infusion of 50 grams going before, during, and after the dental treatment. And that was literally, if you could define a moment, the moment in which my life changed. I had no idea what vitamin C was, except, hey, it's that vitamin inside an orange, blah, blah, blah.
The sunshine vitamin, yeah.
And I looked in the medical textbooks, and there was zero mention of it, even though I later on learned out that there are 85,000 articles in PubMed on it. And anyway, that began my journey. And starting out with vitamin C and then going through everything else. And of course, for those who are listening, vitamin C is your premier antioxidant in your body. So it meshes quite nicely with what we're talking about, oxidative stress. Now, in the course of all of this then, as I did more research and I saw what helped people and what did help people, it became apparent because early on, very early on, I was told and then I witnessed that any sort of poisoning, any sort of toxin exposure, no matter what the toxin was, thousands and thousands of different toxins, this one agent, vitamin C, could neutralize the toxicity and save the patient. And I said, well, how can one substance neutralize the negative impact of literally thousands of different molecules? And the only answer was, the only way a toxin causes problems, causes symptoms, is by promoting oxidation, by either directly oxidizing biomolecules or by using up antioxidants in the blood like vitamin C. So when you oxidize a biomolecule, RNA, DNA, enzyme, sugar, fat, you are taking electrons away from it. So it's a molecule with a depletion of one or more electrons.
Okay.
And what that does is it completely neutralizes the ability of that molecule to function normally. You basically cut that molecule, it becomes a non-player. All right. Whereas vitamin C can come along and do one of two things. It can redistribute and bring electrons back to those biomolecules, restoring them to a normal state, or it can quench the toxin while it's still in the blood by giving electrons to it before it has the opportunity to take electrons away from the molecules inside the cell.
Right.
And it also became apparent, and this was what was really surprising to me, is that in the literature, you hear a lot of expressions like, put up any disease and put up the phrase oxidative stress, and somewhere you'll see in the article, well, oxidative stress is associated with, causes, elevated with in this disease. Yes and no. Oxidative stress doesn't cause disease. It is the disease. There is no other disease process going on inside a sick cell, no matter what the disease process is, other than the unique distribution of what biomolecule is oxidized, where is it located, where is it concentrated, and that's where the differing properties of toxins cause different syndromes, because whether that toxin is fat-soluble, water-soluble, large, small, determines where it goes and where it inflicts that oxidation. And, well, that was pretty big-time stuff. And I realized then, and not only was it theoretical, I've yet to see, and I've searched for it. It's kind of like I've tried to undermine myself over the years,
Yeah.
and I can't find an exception. See, now one of the really recent things that people should realize too is, I was in the dark for 29 out of the last 30 years, is that vitamin C and other quality antioxidants are not the sources of new electrons. They're the distributors of. Your source of a new electron is your diet. That's where all your new electrons come in. And whether you have a large network of antioxidants in the body determines that if those electrons go where they need to go. And this is important because, well, the example is if you have a perfect diet but it has no vitamin C in it, you're going to die of scurvy.
Yeah.
Okay. Even though you're getting in huge amounts of nutrition in it, you need the distributors. It's like having a widget factory, making thousands of widgets, and you only have 2 distribution trucks versus thousands of trucks. Right. So you need to get the widgets around. And because of this, and this is very recent, I ran across literature that made it very clear that it doesn't matter whether you take an antioxidant in its reduced form or its oxidized form. You can take it in either form and it's equally effective.
Because it's a carrier.
It's the carrier. It's not the source of the electrons. You just get it in and then it starts pushing the electrons around. But supplement companies don't realize this. They all press on selling things in their reduced form. One good example, exception to this, is coenzyme Q10. They sell it as ubiquinol, which is reduced, but they also sell it as ubiquinone, which is oxidized. And both of them do equally well. The ubiquinol seems to do a little bit better, but only because of its absorption characteristics, not because of the fact that it's got the extra electron.
Right. And the CoQ10 is part of that. It's part of that antioxidant cascade.
Right, absolutely.
Vitamin C, right? So it's a multi-step process where it's kind of like pass the buck, and then you get to the end of the line, and then they start over again. It's a pretty fascinating, and I'm sure it's oversimplified, but it's still a pretty fascinating thing that you have this series of molecules that work together to manage the oxidative stress in the body. And when you're depleted in one, and the master obviously being vitamin C, but if you're depleted in one, it's going to disrupt that whole cascade. Is that correct?
I call it the antioxidant matrix. I mean, you have a matrix of antioxidants. They all support each other. Vitamin C and glutathione, your most important intracellular antioxidant. Lots of literature showing how one will help restore the other. Also, vitamin C with fat-soluble vitamin E in the membranes of the cells help keep those in the reduced state that allows it to pass the electrons away through more easily. So yes.
Right. And so, but interestingly enough, you're not speaking to needing all of those molecules in the chain necessarily. You're really saying that vitamin C is kind of the master molecule. I mean,
the reason is, as I see it, the reason is the characteristics of vitamin C. Number one, it's a small molecule. It is water soluble. Water solubility gets you just about everywhere in the body eventually. It uses the glucose transporters to get inside the cell. So whenever there's an insulin effect taking place inside your body, which is almost all the time, if you're not grossly diabetic with an abundance of glucose in your circulating, the insulin is pushing the vitamin C inside the cell. Vitamin C also is capable of donating or passing along 2 electrons rather than 1. It also has, interestingly enough, a little esoteric, but it has an intermediate state called the ascorbyl radical, where that's 1 electron depleted. And so it sort of is an intermediary stage where, depending on the needs of the microenvironment, it can donate an electron or it can take one away, whatever the micro situation calls for. Yes.
Yeah.
And the other thing, too, is the simple fact that vitamin C has a deficiency syndrome. Okay, a fatal deficiency syndrome. I mean, if you had 0 coenzyme Q10 or 0 vitamin E, I mean, I'm certain you could make yourself sick or be less healthy. But if you bring in 0 vitamin C, you die of scurvy. So that also is the compelling way of showing the unique effect of vitamin C. The other thing, too, is a lot of docs out there in the supplement industry, I won't name names, but they talk about super powerful antioxidants like astaxanthin. Well, astaxanthin is a fat soluble and it's great for the eyes. No doubt about it. And they say it's 6,000 times more potent than vitamin C on the scale where they measure electron availability. Well, that's fine and good, but it's so misleading. All right. Again,
Oh, well, tell me about this, because I just
no,
talked
I'm
about
not
this
saying it's
recently.
not good. I'm just
Yeah.
not saying you're not taking care of your antioxidants needs by taking a large amount of astaxanthin and no vitamin C. You still use vitamin C is still the basic truck that has to
Right.
move around. If you
Right. So you
don't
still
have those,
you need both.
you need both. Absolutely.
And you won't die if you don't have astaxanthin,
And
but
that's
you
the
will
other thing
die
too. As
if you
far as
don't
I'm
have vitamin
aware,
C.
there's no fatal deficiency syndrome. And I mean, there are fatal deficiency syndromes with other vitamins. I mean,
Yeah.
vitamin B3, Pellagra,
Yeah.
etc. So, and not with astaxanthin. So it's just one minor thing that
That's a
gets me
really
upset.
interesting
Yeah.
point. Yeah, no, that's a really interesting point, that astaxanthin, for all that we talk about how powerful an antioxidant it is not associated with a disease state in humans
Hmm.
when it's not present, whereas vitamin C is associated with, to your point, a mortal disease state if not treated in humans.
That spawns the old phrase, "The proof is in the pudding."
Yeah, exactly. No kidding. So let's talk a little bit about how people warn about too many antioxidants in the system, or the timing of taking antioxidants. So definitely around exercise, we talk about maybe not taking antioxidants too close to exercise, so that we actually allow a certain amount of oxidative stress as a hermetic stressor, and then maybe in a couple of hours time quench whatever's left over. Are you in that camp, or do you disagree with that position?
I don't think it's significant. I don't doubt that there are certain stressors, and I mean, inside the milieu of the cell, obviously, if you get too much oxidative stress in one spot, that's going to trigger reactions that's going to try to quench that. But the fact of the matter is about exercise, etc. I mean, I'm almost 74 now, but 20, 25, 30 years ago, I was lifting weights on a regular basis. And I had access to a clinic where 2, 3, 4 times a week, I'd give myself 50 grams of vitamin C IV. And myself and my buddies at the clinic, we do this for several days in a row. And far from depressing physical performance, there were times when I went really hard on the vitamin C for a few days in a row. And this may or may not be impressive to you, but anybody that lifts weights on a regular basis will be, is for one day, that one particular day, my strength would be 50% greater.
Really?
Yes. I mean, it would shock me,
Wow.
but I could keep the, the IV vitamin C going day and night. But to me, it's just, and the interesting thing too is they have a lot of stuff about exercising and muscles and muscle deterioration. I'm going to tell you, just as an aside, the muscle deterioration is because you don't pay attention to your hormones. All
Mm-hmm.
right. And I mean, friends of mine, when they see me, they can't believe the muscle mass that I have right now, but I haven't lifted anything for 25 years. But I have made sure that my testosterone level is completely normal. So many people, they get older and, hey, docs are lazy. I mean, it takes effort and time to adjust hormones and follow them up on patients, this, that, or the other. And so many times the testosterone, the estrogen, the thyroid hormone, and the cortisol just get tossed out the window. And they're arguably the most important modulators of how well you maintain your metabolism or just start to deteriorate. I mean,
Yeah.
I see people my age, and I'm not talking about me and muscle bound. I mean, just muscle tone. Okay.
Mm-hmm.
And I see people my age and younger, the skin is just falling off their bones. And I said, and to me, I might be oversimplifying it, but I think that's pretty much, they've completely neglected their testosterone for a couple decades.
Yeah. Well, I mean, there's no doubt that testosterone levels I mean, all hormone levels, but definitely testosterone levels are tanking. And we're seeing it
And for
even.
the ladies, some of the ladies could decidedly use a certain amount of testosterone. Nowhere near a
100%.
masculating dose, but definitely to maintain muscle tone for sure.
No, it's definitely on the, the pro-aging or anti-aging, whatever term you want to use, plan of most doctors is maintaining reasonable testosterone levels even in women. And
True.
and that, and paying attention to how important that is in like I think increasingly we hear, and there's even now doctors who focus their entire careers on speaking about how muscle is the organ of longevity, right? And it's interesting. I think it's because when we're
I would
younger,
say it's the indicator organ of longevity,
okay,
personally. Yeah. Right.
but we need it, right?
Right.
Like
Yeah.
you
Right.
need
Right.
to
Yeah.
maintain it. To your point, if you maintain it, it keeps you metabolically flexible. Hopefully,
Right.
it keeps you physically able so that you can keep moving around.
If you maintain it, it's an indication you're doing everything right.
Exactly.
Right.
And
Right.
it's the exercise, it's the lifestyle, it's the sleep, and to your point, it's the hormones. So oxidative stress around workouts you're feeling are not that big. It's not like avoiding the antioxidants around workouts is not a thing. It's getting
Would
overplayed.
would not be my recommendation at all. No.
Okay. So,
But let me
when we
say, there's a lot of people out there, and it's crazy. They're trying so hard to make a name for themselves. They'll say anything as crazy as they can, and people say, "Well, he or she couldn't possibly be saying something that crazy unless maybe it's true." I mean, I've heard people assert vitamin C causes cancer. I mean, it's just
yeah.
yeah, and get a following. So I mean, it's so many people out in supplement land. They want to carve a niche and this, that, and the other. So I maintain a bit of skepticism for a lot of it, but I also maintain I believe an open mind.
Yeah, no, and I think curiosity is important, right? But now that you brought up cancer, I think it's an interesting point because there's definitely a giant school that uses high dose vitamin C IVs around cancer. And yet, if you've ever known anyone going through cancer treatment, their doctors are like, oh, no, 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 there'll be no antioxidants during treatment. They're very concerned about this to the point where, it seems almost crazy. Do you want to, without risking life and limb, let's talk a little bit about vitamin C and cancer, because I know that there's clinics that do vitamin C infusions for
Sure.
cancer patients.
No, I mean it shouldn't be considered possibly crazy. It is crazy. I mean that's the foundation of health. All health is having a normal vitamin C level inside your cell. If you have a normal vitamin C level inside your cell, you've got a normal cell. And that's always the goal, no matter what your disease is. And that also goes back to the oxidative stress. You no
Mm-hmm.
longer have increased oxidative stress if your vitamin C level is inside your cell is normal. Now, what gets lost in the shuffle with cancer, all of it, is the fact of what causes cancer is not that a few cells go crazy. It's that you have ongoing sources of extra high oxidative stress settling down in a given spot or a given tissue. Almost always, but not 100% of the time, this comes from focal infections. Okay, there's nothing that produces more oxidative stress than when pathogens take up space inside a tissue. This is the reason for all of breast cancer. It drives me so crazy when I see young, beautiful, wonderful women going straight to their oncologist and getting brutalized with chemotherapy and amputation of their breast and dissecting out every lymph node in their armpit. I wrote an article on this. It's called Root Canals Cause Breast Cancer Frequently. But there's 255 references inside this article. And it's very clear when you have a breast cancer and you actually biopsy it or take it out, it's filled with pathogens, not innocent microbes, but pathogens. All of them coming from the mouth. Every time you have infected gums, infected teeth, infected tonsils, and you chew on them, you do two things. You express pathogens into the bloodstream, but you also express them into the lymphatic system. And that's why there's so many thyroid problems too. It's just sitting there, if you will, as the toilet bowl to your mouth, draining everything that's going through it. And when it goes down into the breasts, totally consistent with this, the women with the larger breasts have more problems. Why? Because it's a lot easier for the lymph to become static and not continue to move. That's why, in my opinion, only 1% of breast cancer is in men, because there's nothing to impede the lymph drainage from coming into the and going directly out into the armpits. So it's the stasis of the lymph, stasis of infected lymph. That's the root of all breast cancer.
Well, what about the link to, like, for the estrogen, the HER2 breast cancer? Like, there's a link between estrogen and the growth of the tumor. Is that
all conditions have accelerative factors, but
right?
that would not be the factor that's causing it.
That caused it in the first place.
It's just like heart disease. Okay, elevated cholesterol does not cause a plaque to develop, but once a plaque is formed, for a bunch of other reasons, it's beyond the time but we have to discuss. Once a plaque is forming, high cholesterol can help evolve it, and so similar there. So it's that type of situation.
Well, and oxidative stress plays a role as well in plaque formation.
Absolutely. I mean, it's focal scurvy of your coronary artery, quite honestly.
Interesting. So you bring up the mouth, and you started this conversation by saying that your first mentor was Hal Huggins, who was a biological dentist. So
he's the first person who taught me medicine.
Which was after you were a cardiologist. So that's
right.
Interesting. And also when we were talking before the podcast, you mentioned dental issues. So can we talk a little bit about oral health? Because
Sure.
I think that definitely this is another storyline that's growing, and that is the importance of the oral cavity, of the gums, of the oral microbiome to our overall health. I mean, in traditional Chinese medicine, I believe that every tooth is linked energetically or through a energy pathway to different organs.
Exactly.
So maybe let's just talk a little bit about that and where kind of vitamin C fits into this story. Because vitamin C, the other thing I wanted to bring up, which will tie into this, is one of my teachers at school said, and about vitamin C stands for collagen as well. And people tend to forget that in terms of its ability to support collagen, wound healing, that kind of stuff. So exactly. I'm going to leave you with that little package to kind of unpack for the audience.
Well, based on that, I wrote an article that said coronary artery disease is a non-healing wound. Okay, and that's exactly it, because they have a depletion of vitamin C. You can no longer make enough collagen or structural tissue to keep the artery strong, and then you start a compensatory development of an atheroma to make the wall thicker so that the wall doesn't rupture. Ultimately, the body wants to prevent you from dying. Yeah. And the thing that's most important in the coronary artery is that it doesn't get so weak that it ruptures. That's instant death. So how do you strengthen an artery without the primary component, vitamin C, to make the structural integrity? How else would you possibly strengthen that artery even for a limited period of time? And that's make it thicker. And that's what the atheroma does. It makes it thicker. It can't make quality wall anymore, but it can make a thicker wall. And then obviously at a certain point in time, it gets so thick, you block it off and you have the heart attack.
Right.
And this is manifest too we're going back to the mouth, but continuing with this theme I just mentioned in the heart. In a study in 2006, they took 38 individuals with known coronary artery disease. They already knew they had blockages, and they did angiograms. Okay, and then once the catheter was in place, they did something called atherectomy, which is really a coronary artery roto-rooter. They actually scrape plaque out of the artery and open it up. Now, in 36 out of 36 of these patients, they found over 50 different fungi, virus, and oral bacteria inside the plaque. Okay.
Wow.
There should be nothing there. So as I like to say, 36 out of 36 is pretty close to 100%.
Well, I mean, it's speaking to, it's interesting. I just recorded a podcast earlier today about Parkinson's and Alzheimer's and amyloid. Well, in Parkinson's, I think it was in Alzheimer's, how the amyloid plaque is a defense system, and it's an attempt by the body to sequester toxins, which is exactly what you're referring to here, only in a blood vessel, where the plaque is essentially a mechanism of action of the body to both. And in
fact, those plaques are filled with pathogens. Yes.
Right. So there's sequestering pathogens, in addition to, I guess it started in the first place, or it landed there because there's a weakening of the wall, or there's damage to the wall of the artery. Did I get that right, or am I?
Well, no, probably. I think the reason that we see it, don't get me wrong, when you have pathogens in the mouth and you systematically look throughout the body and do really refined testing, you will find focal infections and chronic pathogen colonization in every affected tissue where there's a chronic disease. That's because the only reason a chronic disease stays chronic is because you're continuing to put more toxins and pro-oxidants in it, and you can't bring enough antioxidants against it. Now, in the case of heart disease, in particular, you have a big infected tooth here. Maybe it hurts, maybe it doesn't. Every time you squeeze down, pathogens and toxins go into the bloodstream more effectively than an IV, actually.
Yeah.
Okay, now, here you go. The pathogens go into the bloodstream. Venous circulation, low pressure, makes its way to the pulmonary artery, low pressure, pulmonary vein, low pressure, into the left atrium, low pressure, left atrium into the left ventricle, boom. You go from minimal pressure to maximal systolic pressure, and the coronary artery gets about 20% of each ejection from the ventricle. So that gets the highest concentrations of pathogens because they're all coming out so quickly. And then there's mechanical damage if it hits different crevices. But mind you, when you look at the rest of the vascular system, you'll also see cerebral aneurysms with these pathogens. Mm-hmm. You'll see in the femoral and popliteal arteries, you'll see these pathogens. You just see them most commonly in the coronary artery because that gets the initial hit of the highest pressure and the highest concentration.
Right. It's the first point of exit, as it were. Okay, so oral health, critical. Vitamin C will help with oral health to a point. It's not going to make up for the fact that one doesn't brush their teeth or whatever the case may be, but I would imagine that vitamin C goes a long way to supporting healthy gums and tissue.
And hydrogen peroxide, too. Let's the thing with, in a nutshell, since our time is somewhat limited, let me just say,
we have a bit of time still.
anyone who sends me an email, I'll send them a whole host of articles and several free ebooks, including the book Hidden Epidemic,
nice,
which talks about these infections causing all heart disease and breast cancer. So
is that your book?
So yeah, that's in my book, Hidden Epidemic. Now, because of that, everybody needs to get what's called a cone beam computed tomography of the mouth, okay? Because regular dental x-rays probably miss 70% of infected teeth, maybe 80%, okay? Mm-hmm. So there's almost overlap and this sort of, but when you get the cone beam, and this is important because it's tragic, but it also explains why the whole world has so much chronic disease, is the vast majority of chronically abscessed infected teeth are completely pain-free. So you have no idea at all that you have a grossly abscessed tooth inside your mouth until you do this test, okay?
And is that because the nerve has died, basically?
Well, no, it's going to hurt like hell when you pull it out and everything like that. Yeah. The thing is pain has a lot to do with the rate at which something develops. Okay. So when you have an acutely abscessed tooth, if you've ever had one, it's about as painful as you could get.
Okay.
That's
I haven't
because
had the pleasure. So
that there was an acute breach. A lot of pathogens got in, and then you started getting a rapid growth, and that put everything on stretch. Everything on stretch.
so the swelling. Yeah.
Whereas what happens most commonly is that people get older, either through a little bit of a decay, or sometimes from gums coming up to the pulp. What happens is, hey, everything breaks down as we get old, right? So you chew, and you might not even realize you cause a slight fracture.
Right.
And that fracture just lets in a little bit, a relatively small amount of pathogens, and then it starts to seed and then slowly grow. But it grows slowly. So there's no acute stretch put on it, and it's zero pain. So that's how you get these type of teeth. And unfortunately, and the studies are all in the book, it's very, very, very common. There's no age that's immune. All right. So when your 5-year-old gets leukemia, you look at the mouth just as much as you do in an adult. Okay. Because lots of kids have extensive decay, and they have these infections, and you don't want to go straight to chemotherapy. Well, I mean, in my opinion, you don't want chemotherapy at all, but that's another story. So you need to avoid root canals. Root canals are 100% infected. They're you take out the ability of the body to deal with an infection when you carve out the pulp, the nerve, the blood supply, the connective tissue, everything. You need to maintain the healthy gums. So we started out with talking the vitamin C. That's important, but probably specifically for healthy gums, the most important thing you can do, obviously you want to have a good diet and all that, but you want to forget about flossing. Water pick. You water pick, and you put a cup of 25 or 30 cc's of 3% hydrogen peroxide in the water bin along with the water, and you water pick with that, and you will take advanced periodontal disease and bring it back to normal in a few weeks to a month. And that's probably the primary reason that initiates all dental disease, that further initiates gut disease as you swallow these pathogens, that further causes all the diseases in the body. So it's an incredible chain of events, all right? But if you start by maintaining healthy gums and you stay on top of it with diagnostic tests to make sure that no teeth have become spontaneously abscessed. But water picking alone. I mean, when you do flossing, I mean, would you go to your garden and get your hands all dirty and then just try to scrape them clean? Use water. Use water.
Yeah.
Okay, so
what do people do who have existing root canals? Like, what should they do? Is there a way to remediate the situation? Is there a way to seal that off? So that is there anything that people can do who've already had a root canal? Because obviously
when I say this, I am not trying to be sarcastic. Okay.
Okay.
Only if you want to maintain optimal health in the future, they must all come out.
So the root canals need to come out, but what does that mean? Don't you just still end up with it?
Extracted, but properly extracted. You need to clean out the socket. So that's important too, because we have the regular traditional dentist versus what we call biological dentists. And I've stated for a long time now that the worst thing you can do for your health is to have and see on a regular basis a traditional dentist. But the best thing you can do for your health is to have and to see on a regular basis a well-trained, well-educated biological dentist that uses ozone and all these other techniques for optimal dentistry. I mean, it's like it's black and white.
Night and day. No, it's completely different. I mean, I recently, over the last few years, have switched over to biological dentist, and it's a completely different game.
Now, certainly, you're going to have some men and women that live until they're 90 or 95 and they had root canals in their mouths for the last 20 years. If you want to take that chance, that's up to you. But the point is they're always releasing toxins and pathogens. Some are done better than others. I will say this, I never recommend a root canal, but if you decide for your own personal reasons that you're hell-bent to get a root canal, you don't want to lose the tooth, blah, 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 by all means, see a high-volume endodontist to do that, and not the regular dentist that does one a week versus the endodontist that does 30 a week, okay? Because the technical expertise of the root canal is important. It doesn't, the teeth always remains infected, but how much it abscesses and how much it releases into the body is affected oftentimes by the expertise with which it was done and how well it was sealed.
Okay. Got it. All right. So that's the mouth. And actually related to the mouth in some ways, but not completely, is heavy. You mentioned heavy metals. Occult heavy metals as being a massive source, again, of oxidative stress in the body that leads to
more so than we
diseases.
could ever have imagined. I mean, here I was with Dr. Huggins, looking at mercury, looking at root canals, all this sort of stuff, 1999, and the Journal of the American College of Cardiology comes with a paper that I basically said, oh, that's interesting, and then nothing sunk in until 24 years later, like about 6 to 8 months ago. And what the story was is they did a study on patients with advanced congestive cardiomyopathies, big failing hearts, couldn't contract, that were being considered for heart transplantation. And for some reason, the authors when they did the endomyocardial biopsies as part of the workup, they also looked at heavy metal levels inside the cardiac cells. Well, they found 22,000-fold, that's 2,200,000% more mercury inside those cells than in a normal heart.
No way.
They found 11,000-fold more antimony.
Antimony, and is that a dental?
Well, there are some things that have antimony in the dental materials, but the thing that gives you most of the antimony, because it's used to make this substance, is the clear plastic on your water bottle.
Oh, those plastic water bottles, they're going to be the end of us, aren't they?
Yeah, I mean, they're already talking about all other sort of garbage that plastic has, but I think the worst one is this. You got to remember too, or you got to realize, because a lot of people haven't heard of antimony or maybe antimony. I'm not sure what the problem.
I don't know. But you never come to me.
Okay,
never come to me for pronunciation ever.
It's as or more toxic than arsenic.
And so it's just accumulating in the cardiac cells.
So the problem that we have is we always say, well, we're exposed to thousands of toxins. What are we going to do? Well, that's true. And you maintain your antioxidants, you do everything you can to keep the toxins moving. But when you're able to identify definitively that one of those horribly toxic toxins is accumulating, then it's incumbent upon you to start getting the garbage out. So everybody should be on a chelation program. I wrote another article on this about how toxins cause cardiomyopathy and go into a lot of the different solutions on this. Again, that's all available. People want more information, I give them these links, no problem, because
we'll put the links in the show notes, so that people can access them. So when you say chelation program, tell me a little bit about what you mean by that.
Well, that's what I'm saying. There's a lot of detail in it. Okay.
Yeah. Are you talking about like an active, like EDTA chelation program, or is it more of a daily?
Most people should be on a form of EDTA. Not necessarily. There are some good oral forms, but there's a lot of fraud in EDTA supplements too. But they make some that are highly concentrated for those who have physicians who will work with them, giving intravenous injections of EDTA. It's also important to realize that a strong antioxidant intake is also, agents known to bring toxins out of the body, including heavy metals, are not only vitamin C, ascorbic acid, but also citric acid. Okay, I think this is probably one of the main benefits of of citric fruits is not the mediocre vitamin C content, but the fact that it's a strong chelator as well.
Mm-hmm.
Very important across the board, inositol hexaphosphate, IP6. Also, sauna. Okay,
Yes.
sauna. We want to, the best investment you could possibly make in your long-term health is to have and utilize at least several times a week really deep sweat in a far infrared sauna. Okay, and the only real downside to that is you got to remember you're wasting a lot of magnesium in the sauna. So you have
you
to
got
be
to replenish.
really be good on that.
Yeah.
Okay, if you're and now I also put together a group of supplements called the Super 8 supplements. I mean, I don't sell them, I don't make any money off of them, but it's based on what you need to maintain a normal calcium level inside your cells, which is critical, as well as normal ATP levels. And the feedback I've gotten from people using this regimen for just about anything has been profound.
And where are they going to find that? In which of the resources that we're going to link in the show notes?
Well, I
Is
wrote
that
an
in one of your
article on
books?
it. I wrote an article on it. So I mean,
So can we have that? Will we get the link for the article?
Sure.
Okay. I'm just making a note too, because otherwise I will forget.
Well, I'll send you an email right after this. It'll have everything that you can.
Phenomenal. Thank you.
Share. Okay.
So it's interesting that you mentioned IP6 because until today I'd never heard of it, and both you and the other guest that I recorded with today mentioned IP6 today. So that means I need to ask you about IP6 and elucidate a little bit on that for us, because it sounds to me like maybe it's a little bit important.
It's phytic acid, okay, which is common in your food. The thing is it binds up metals very, very avidly. So in order to have it have maximal effects, you need to take it first thing in the morning on an empty stomach, so it doesn't start binding up a lot of the stuff in whatever food you eat. So then you end up neutralizing its effect. But when you take it in on an empty stomach, there's a host of literature that shows how effectively, for example, that it dissolves calcium stones wherever they are in the body. Okay, so it pulls out calcium, it pulls out iron, okay, helps get iron levels down. And make no doubt about it, too. People should realize, because there's a lot of stuff that says, no, it's not true. I mean, sauna will sweat out iron very, very well. Very well.
Yeah.
You have young people, youngsters on sports teams that do active sweating, and they will routinely sweat themselves down to an iron deficiency anemia by the end of their season. So it's not hard to get rid of iron, but they would make you think that it is.
Okay. Yeah. Interesting. Okay. So that's IP6. We have the Super 8 supplements, Chelation, sauna. I love that you said infrared sauna. I was just in mine this morning.
Good.
And okay. So there's not a question I can ask. I don't think that's not going to lead us down another beautiful path. But before we run out of time, I would love to talk a little bit about the role of vitamin C. Is it the role of vitamin C? Well, actually, you have a full protocol. I know this, but what's come into our sphere in recent human history is the spike protein,
Right.
and so I know that you've been very actively researching and creating protocols to help people reduce their load, or maybe, dare I say, eliminate spike protein from their systems. And you had a protocol, and now I think you told me that you've updated it completely.
Updated. Well, the Super 8 supplements is part of the primary protocol. But what we've now found is I've worked with a colleague in Switzerland for a couple years now. And he told me a couple years ago he was routinely curing or resolving, whatever term you want to use, people that had chronic COVID or long haul COVID,
Long haul.
sick for months, even years. And he said, what do you think of that? I said, well, it looks impressive as heck, Fabrice. I said, but we need to prove it. I said, what do you mean? I said, well, I'm just never impressed if something takes away somebody's headache or something takes away their backache or this, that, or the other. What I'm impressed by is change in laboratory. Well, as it turns out, chronic spike protein syndrome, persistent spike protein, is almost always, I would love to see the percentage, but I don't know what it is, correlates with increased D-dimer. D-dimer is the test that looks at whether you're clotting your blood too much, okay? And that's ultimately the primary pathology that spike protein inflicts on wherever it's present most in the body. Well, as it turns out, Dr. Fabrice, using a special form of ultraviolet blood irradiation and a special technique with oxygen at the same time, these patients were not only completely resolving their symptoms, but within a week or two, they were getting massively elevated D-dimers come down to normal. And this is on the order of 90 to 95% response. So,
wow.
And so far over the course of the past couple years, when you're talking about resolution versus cure versus permanence, he hasn't had anybody rebound or come back with recurrent problems. So I like to understand stuff, but I'm never opposed to something that gets the job done, even if I'm too stupid to appreciate what it's doing, as long as it's safe, and there's nothing safer than this.
Okay. And so this is the Super 8 supplements, which I'm sure vitamin C is a starring role in that protocol. But this long, so that is the protocol for the long COVID?
Yes, and there's another article on this that I've written that puts out all the details there. We're right now in the process of trying to reproduce these results at the Reardon Clinic in Wichita.
Nice.
Yeah.
Okay. Amazing. But definitely at this point, the results that you've seen with people who've used it have been remarkably effective.
Profound.
Okay. So let's talk as our final topic, unless I think of something else, which I could, you never know. I'm known for my long goodbyes. But let's talk as our final topic, at least our first attempt at that, about the source of vitamin C. Because I know that people are very concerned. You know, I've read a lot of people very concerned about where the vitamin C is coming from, that all vitamin C is not equal, that some vitamin C is either moldy or grown from mold. And so seeing as you're the resident expert on the big C, being the vitamin,
well,
I'd love your thoughts on this. Like,
when people start talking about quality, this, out of the other, I mean, all I know is to use products that I've had success with. I mean, I don't have a laboratory. I mean, there might be 50 different brands, and I can't tell you if one brand is likely to be fraudulent or not, or likely to be, or they're lying and they haven't done proper purification. I mean, you don't, you get in your car and you trust the steering's not going to break. There's a lot of stuff we just put our trust in. So all I can say is if you're going to believe what's written on the bottle, and it's been properly tested and assayed and that sort of thing, there's certainly no need that I know of to worry about whether something's moldy or whether or not it's improperly prepared. But, you know, fraud is perpetrated all the time. Or regular food is labeled organic food, anything to make a buck. So you still has to be buyer beware. All right. So you still have 100%. To do your own due diligence, talk to colleagues, family, friends that have taken this type or that or the other. Now, for vitamin C, the best form that I know of is a liposome encapsulated form by a company I've worked with for 18 years. And let me say,
we can name the company. It's okay. We're allowed.
Now, that would be Live On Labs. They're the first people with it 20 years ago. And I've seen so much profound response with this. What happens in a nutshell is a liposome is a fat-soluble ball that has a water-soluble inside. So you have vitamin C or something else contained on the inside, but the outside has the same membrane that a cell in your body has. So you get it completely absorbed, no effect on the bowels. It's not free circulating in the blood. I mean, when you take vitamin C and it gets into the blood, that's not the same as this. Vitamin C circulating in the blood is not the same as a liposome encapsulated, because when it gets to the cell, it immediately goes to the cell and reverse pinocytosis goes into the cell. So it delivers an energy-carrying substance without consuming energy.
Yeah.
So that's always a goal. Get get energy from point A to point B without consuming a lot of energy in the process to do it.
And you don't need the insulin at that point
No,
to get it in,
absolutely. Very good
right?
point. Very
Because,
good point. You don't need the insulin at all.
right.
And unfortunately, I have seen so much fraud in this industry. I actually saw ascorbyl palmitate on the backside. Ascorbyl palmitate is a slightly fat-soluble form of vitamin C. And on the front of the bottle, it said liposomal vitamin C. So,
Really?
so I mean, it's kind of like, well, we're going to do this until we get caught, and then we'll stop.
Crazy. So, all right. So Live On, and I've used Live On, some of the Live On products. They're the only trick to the Live On products is they look beautiful when they come out of the pouch.
Yeah.
But don't make the mistake to think they're going to be delicious, especially the vitamin C. It's got this gorgeous orange color. You're like, oh, it's going to be a shot of orange. And it's not.
Or a shot of honey.
Or whatever. It's none of those things. But the cool thing about it, the best way to take them, guys, is if you get your hands on them. And they're these really neat little single serve pouches. So they're great for travel. They're just amazing. And I don't even
it
have a
also
code
prevents
for
them from oxidizing. So many
Exactly.
people
It
make their
protects
quote
them.
unquote liposome all in a bottle. Every time
Yeah.
you go in, it's
You're exposing it to oxygen.
Exactly.
So these, and the trick is you just squish them into a tiny little bit of water. You swish it around till that kind of like the little blob starts floating in the water, and then you just shoot it down, and you never taste it, and and down she goes. So I definitely wanted to share this piece because the liposomal C is such a it seems that everywhere you go, oh, liposomes. There's, you go to a drugstore and like the store brand name has liposomes, and you're kind of looking at it going, I don't know, it looks like a tablet to me. Doesn't look very liposomal. And maybe there's a way to make a liposome into a tablet. But
and one quick way too, it's sad to say this, to look at the price. You can't make it cheaply. I mean,
Right.
So you can't make it cheaply. It's an involved process. And at least in the case of Live On Labs, high quality control on each batch. Each batch is tested separately. And so when you see you're getting an equivalent amount of vitamin C, for $15 versus $45, well, that's sort of a sign right there.
It's a sign. So what would you recommend? And I know this is a very tough question to answer, and maybe you want to give ranges or some qualifiers, but for the average person, is there an optimal dosage of vitamin C that you would recommend in a day? Typically?
For a given person, no. I mean, it's like saying, some people have this much oxidative stress, and I mean, it's different for everybody. That said, when you consider most people with whatever dental toxicity they have and other things going on, even though their body would require a lot more vitamin C for optimal health, a practical range of supplementation would be 3 to 9 grams a day, 3 to 9,000 milligrams.
That's still a fairly not hefty dose.
And one of the things too is if you don't go with the Live On liposome encapsulated, which you can really get a good dose and just take it once a day because vitamin C goes up and down, is we talked about the importance of, or the fact that vitamin C is going to do its job in its reduced or its oxidized form. Right. And the oxidized form, DHAA and not AA, is very readily absorbed inside the gut, much more than the reduced form. So if you make yourself a nice beverage at the beginning of the day, whatever you choose, this out of the other, with 3, 6, 9 grams of vitamin C a day, it doesn't matter if it starts to oxidize, because as it starts to oxidize, as the day goes on, it's becoming more bioavailable, not less. So that's a good way to get a good dose of vitamin C. And, whatever your desk is, where you work, just sip on that all day.
But you're still using are you still using the Live On liposomal, or you're taking
the Live On
liposomal
would prevent you from needing to do that. So I'm saying for somebody,
I see.
Yeah, right.
So you're just taking like a vitamin C powder or something. There's, I think, there's there's a bunch of companies. They've got vitamin C powder. It actually tastes kind of good. It's not liposomal. And I think what bears mentioning, if anybody hasn't had the experience of taking too much vitamin C that is not liposomal at one time, you do want to sip it over the course of the day, because a hefty shot of 3, I mean, frankly, even 1 gram of vitamin C in one shot
Now,
that isn't liposomal will send you
now I'm
running
not saying
to
it's
the
the
bathroom.
best, but a product that I've used long time, most of the time that I've known about vitamin C for the powder
Hmm.
is sodium ascorbate powder from Now, NOW.
Now, yeah, and you know what? That's a really affordable. Um, it's an affordable brand
Right, right, right.
because I mean I'll use the Designs for Health, which is a great brand, but and they have a really nice powder as well, but it's going to set you back a few dollars. So the Now brand, I think it's easy to find, it's easy to get, and very affordable. Okay, well, I know if I come up with 10 more questions, we're going to still be sitting here in about half an hour. So I want to thank you so much. I think that, deep dive into vitamin C and its benefits. And obviously when we're treating, hopefully the audience got this from the conversation, when you're treating serious conditions and you're using vitamin C as part of the protocol, whether it's a cancer or it's an infection or whatever the case may be, we're now going into super doses, whether it's 10,
Right,
15, 20, even
right.
to your point, 50 milligrams. I know that there's physicians that will use vitamin C IVs, which is a whole other method of delivery for helping to deal with cancer. And, that's one of those things where you want to be working with your medical team
Sure.
to kind of work on. Actually, there is one last question. So if somebody, the age old, oh, you think you're coming down with something, take some vitamin C.
Hmm.
Is our 3 to 9 grams enough then, or are we going to double down?
Well, that's an interesting point. What I have found over the years is people that have never supplemented before with vitamin C, and they start on a good dose, 3 grams, 6 grams, 9 grams a day, and they start feeling better than they ever have. Oh, I'm feeling, my vision's better, my energy's better, blah, blah, this is wonderful. They then develop what I call an enhanced health intuition,
Hmm.
which means they're going along, and then one day they don't feel bad, but they don't feel as perfect as they did the day before. And then you pound with a little more vitamin C, and then you come right out of it. So that's
And boom.
right.
All right. All right. Vitamin C, maybe a little zinc in there and,
Sure.
and
And
your,
plenty of magnesium. Plenty of
and lots of magnesium.
magnesium.
Yeah. 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 No, again, the magnesium is a beautiful thing. We can't say enough about that. All right, Dr. Levy, where do people find you? You're going to send me that email. We're going to have so many resources in the show notes for our audience. But in the meantime, how do people get in touch with you, or what's your online presence, your website, your books, all the things?
My website is tomlevymd.com. TOMLEVYMD.com. And my email, I don't do consults, okay, but I could usually point people into different directions or tell them where to get more information or who they might want to see, is TELevyMD@yahoo.com.
All right, I'm writing this down, although I'm going to have your email momentarily when you send me all that stuff. Thank you so much.
Just send me your request, and then I'll have your email to respond.
Yeah, I'm going to send you an email right when we're done.
Okay, very good.
All right. Well, thank you so much for your time. It's been a pleasure finally getting to have this conversation,
Yes.
And we'll have to do it again in a year or so, because I'm sure you'll have a whole bunch of new information for us at that point.
I hope it won't take a year, but sure.
All right. Well, thank you so much.